Hello viewers, welcome to our Facebook live session. On this World Alzheimer's Day, we have with us our specialist, Dr. Girish Nair, consultant, neurologist at Apollo Hospitals, Navi, Mumbai. He comes with over 10 years of experience in the field of neuroscience. Welcome to our Facebook live session, Doctor.
Great pleasure to be here, Nair. Thank you.
The first question is, can you explain what is Alzheimer's?
Wow. Alzheimer's disease is the most common type of degenerative dementia. By dementia, we mean a condition where there is an acquired loss of cognitive abilities. And cognitive abilities or intellectual abilities are what make us uniquely human. So Alzheimer's disease is the most common neurodegenerative type of dementia. There are other types of dementia as well. For example, dementia that follows multiple strokes or dementia because of alcohol abuse, vitamin B12 deficiency. We're not talking about that. We're talking about dementias where nerve cells are dying out prematurely, and the most common type of neurodegenerative dementia is Alzheimer's, accounting for 70 to 80% in surveys worldwide. And I think that's pretty much true of our country as well.
What are the possible reasons to get Alzheimer's disease?
Well, there are multiple risk factors for developing Alzheimer's disease, and we look at risk factors that have a genetic linkage, meaning they're inherited, and those which are related to the environment. The bulk of the risk for the common type of Alzheimer's disease that one encounters is environmental, and there are small genetic risk factors. For example, a particular type of apoprotein E, which is one of the proteins that's responsible for cholesterol transport within the body. Those are, sit within the cluster of genetic risk factors. But the majority, as I said, is lifestyle choices. For example, being overweight, not exercising adequately, being diagnosed with diabetes, having suffered one or more episodes of head injury, having a cardiac condition, especially having had a myocardial infarction or a heart attack. These are all the environmental risk factors. And apart from that, it's also been noticed that those people who have not possibly engaged much intellectually, meaning a lower education, poor socioeconomic status, etc., are additional risk factors for developing Alzheimer's disease. But at a cellular or molecular level within the brain, the process that drives Alzheimer's disease is twofold. There is accumulation of an abnormal protein called amyloid outside of the nerve cells, and there is also a process of degeneration within the nerve cells called neurofibrillary tangles. So that kind of summarizes how genetic risk factors interacting with environmental insults over a period of time. As you grow older, the risk of Alzheimer's increases, results in changes within the brain that ultimately manifest in the form of Alzheimer's disease.
So, Doctor, what are the symptoms of Alzheimer's disease?
The predominant set of symptoms with Alzheimer's disease is cognitive, meaning impairment of cognitive function. Cognitive function or intellectual function, the typical early cognitive dysfunction that you see in patients with Alzheimer's disease is memory lapses. And this is very, very classical of Alzheimer's disease, that patients tend to get forgetful. They might forget what they've eaten for breakfast. They may forget a person whom they've met recently, and that should be an alarm sign. This should be distinguished from what we call benign forgetfulness, where, in a stress situation, even a person without a problem can sometimes be forgetful. But if simple things are forgotten and the patient himself or herself denies the presence of a symptom, I think that's very, very typical of Alzheimer's disease. Apart from memory impairment, as the disease advances, other intellectual functions tend to get progressively compromised. So over a period of time, they begin to develop naming deficiencies. They are unable to get the right name. They might develop visuospatial disturbances. And as the disease further advances, you might even see the appearance of impaired mobility, tremors, behavioral manifestations, suspiciousness, changes in personality. But if any of these, other features that I spoke about appear early on in the disease, one must question the diagnosis of Alzheimer's. The classical presentation of Alzheimer's is memory impairment.
So, apart from the symptoms, is there any way to diagnose this for Alzheimer's disease?
Yeah. A diagnosis of Alzheimer's disease is very important to make as early as possible because, the disease, the treatment interventions are the most effective when they've been instituted as early as possible. Today, our sophistication when it comes to the diagnosis of Alzheimer's disease has undergone a huge transformation. We typically make use of a battery of tests. Of course, the clinical history, the patient's and the family's account of symptoms is very, very important. Once that part is done, we go through a process of trying to rule out other conditions that can look like Alzheimer's. Especially here in India, we need to rule out strokes, we need to rule out toxins, we need to rule out deficiencies of vitamin B12 especially that I just spoke about. So we do end up doing basic imaging of the brain, an MRI or a CT scan to rule out these other conditions that can look like Alzheimer's. We do blood tests to find out whether there are vitamin deficiencies, there are metabolic parameters that are deranged, and now of great importance is a formal assessment of cognition using a neuropsychological battery, which is performed by a neuropsychologist. This helps us quantify deficits, have numbers to measure, set a baseline, and even use that for follow-up, and that helps us measure the severity of the disease at the time of diagnosis and also helps us track it over a period of time. To summarize, the diagnosis of Alzheimer's disease involves a good history, a battery of tests supported by the neuropsychological profile, and that's how the diagnosis is made.
So, doctor, what are the treatments available?
At this point in time, the treatment for Alzheimer's disease is not very gratifying. We have medications that address, to a certain extent, the symptoms, especially the memory impairment, etc., that one would see, and some of the behavioral manifestations as the disease progresses. So we have, medications like memantine, donepezil, which address these cognitive symptoms, and if behavioral symptoms and agitation and paranoia, suspicion, etc., become, important symptoms of the disease, which it can in a good percentage of cases, the expertise of a psychiatrist and, medications for that. But the real core disease process, which is the accumulation of the abnormal amyloid protein and the development of neurofibrillary tangles, that is not unfortunately adequately addressed so far. And we also know that there is a long latent period between the appearance of symptoms that brings the patient to the attention of the doctor and the beginning of the degenerative process in the brain, which might happen several decades before symptoms appear. So the huge challenge now with Alzheimer's disease is to be able to identify patients who are developing Alzheimer's but are asymptomatic, because the disease-modifying treatments that we are working on in terms of reversing the amyloid burden or preventing neurofibrillary tangles will all be effective before the symptomatic phase of the disease appears.
We come to the last question. What is the new horizon or in future for Alzheimer's disease?
In 2018, the whole approach to Alzheimer's disease and Alzheimer's dementia underwent a massive change because we now realize that it is a whole spectrum. And Alzheimer's dementia is a part of Alzheimer's disease because the disease process, as I just said, spoke about earlier, starts maybe several decades before. And in research centers across the world, we are now developing a multimodal picture of the disease, a model of the disease, and then we are using various measures to track how much amyloid burden there exists, how much degeneration there exists, how much tangles there exists, and how much, in terms of clinical manifestation, the disease appears. The reason to want to do this is because we know now that we need to do very early intervention, so we need to have very sophisticated, testing. So biomarkers for Alzheimer's, to think of a biomarker, it's like this. When a person is diagnosed with malaria, we have a simple blood test where, the bug is picked up and the patient has malaria and you can put the treatment in place. At this point in time, we do not have a biomarker, a reliable biomarker that is freely available that can be offered to patients in a clinic setting. Of course, research paradigms are different. So those are the challenges that are being looked at and addressed. And it is hoped that in the next 5 to 10 years, we should be able to develop a commercially viable biomarker, which is an early, blood test maybe, or a spinal fluid test, or a brain scan using a PET ligand, for example, to make a very early diagnosis of Alzheimer's disease, not dementia, so that we can put in place therapies that will hopefully be developed and ready by then, which will arrest the process of degeneration that ultimately manifests into the cognitive symptoms. Why I say this is because dementia literally destroys the brain. It destroys the very human being that we know and have a connection with. It is devastating for the family, and dementia is not just something that affects one person. The entire family has to deal with it. There is a prolonged course that it plays out. So with all of these factors in place, it becomes very important that we do what we can to prevent. There's a huge amount of research going into prevention, the very, very important role of maintaining a healthy lifestyle, exercise, a nutritious diet, ensuring adequate amount of protein in the diet, antioxidants, micronutrients, omega-3 fats, the good fats which are responsible for cardiovascular and brain health, having good associations. For example, it has been shown that social integration and the presence of close-knit families and rewarding relationships are protective for Alzheimer's. Meditation, yoga, there's a huge amount of research going into what we can do to prevent Alzheimer's disease. So a healthy lifestyle and a holistic approach to prevention, not just looking at it from the brain perspective, but looking at it from the overall health perspective, is what I would think is the future for Alzheimer's.
Thank you, Doctor, for joining this session. Dear viewers, if you have any question related to this topic, please drop your questions in the comment box and we'll address it to Dr. Girish. Thank you.
Thank you very much.